so just a little perspective around all this. Thus far this flu season, we've had 15 million cases of the flu. We've had over 8,000 deaths and over 100,000 hospitalizations. To this date, according to the CDC this morning, we've had 12 confirmed cases of coronavirus in the United States. But right now, coronavirus is really in the U.S. is just in people who have traveled from China. So if you haven't traveled to China in the last 2 weeks, the chances of having coronavirus are very, very, very small. I think we acknowledged we had one patient who screened positive on Wednesday. There's a difference between screening positive and being positive. A screen really is the questions. Were you in China in the last 2 weeks? Do you have a fever? Do you have upper respiratory symptoms, cough, chest pain? That means that they're at risk enough, we're going to take full precaution. We're going to treat that patient as if they do have coronavirus, even though there's no validation or confirmation that they do. So these are fairly standard equipment for airborne diseases that we want to protect our staff from. If somebody screens positive, a couple of things will happen. If they present to a clinic, that clinic will mask the patient, put them in a room, and call the emergency department. If public health finds out or the clinic has somebody come from home, they'll communicate to the emergency department. And that kind of sets our protocols in action. If a patient does screen positive and we know about them, we will meet them in the parking lot, escort them through a side door into a decontamination room, which leads right into an isolation room. So a patient that we have a heads up about will come in through the side, won't traverse through public areas, and really just kind of slides right into a negative pressure room. If somebody does happen to present to triage or our front desk and screens positive, they immediately get masked and immediately get moved to a non-public area, put in an isolation room, and our protocols start from there. If you've been to China in the last 2 weeks and you have those symptoms, please don't show up in the emergency department, please don't show up in the clinic, please call ahead. Let us arrange things, do a screen over the phone, and then get you to the right place to get an evaluation and do things right. So, reminders to get vaccinated, cover your cough, wash your hands, and if you have a fever, don't go to work. Because again, influenza really is much more of a concern for us at this point than coronavirus.